Experts, sponsored by St. Elizabeth Healthcare.
Well, I got a warning today from infection control experts in the tri-state. Flu across the country and right here in our area continues to spread.
Yeah, the danger appears to be especially for young children, and medical reporter Liz Bonus joins us now to share what healthcare providers in our area want all of us to know to protect against it. Liz.
Hey guys, good afternoon. Flu experts at St. Elizabeth Healthcare say we are now experiencing what they call widespread activity, as is the rest of the country. The number of states showing this jumped from 29 last week to 37 this week. The CDC says this week there were 3 additional pediatric deaths from the flu. So we will likely be in homes this week for Super Bowl parties, and that too is raising concerns this will continue to spread the flu, mainly through our hands. Hospitals and healthcare settings have been asking people to use extra precautions against it for weeks.
We are constantly monitoring it to see what's going on with seasonal flu.
Now, seasonal flu at an all-time high. This map shows we are among states reporting widespread activity. The Northern Kentucky Health Department has seen a spike in actual cases, which it tracks. The Hamilton County Health Department, which tracks flu activity, such as medications to treat symptoms and emergency room visits, has seen a rise as well. Coughing, sneezing, and respiratory symptoms hit suddenly with the flu, which means
It can spread very quickly because, you know, you have the droplet, the wetness of the sneeze or the cough, and then you can also have the environmental contamination, which if, you know, you pick up something, you put it on your hands, and then you put your hands to your face, you could actually, you know, be infected that way.
So here's what you need to know right now if you want to try and protect against it. And if you see early warning signs in the very young and the very old, you may need to know that they may need to seek medical care. You see, the main danger in these populations is that the flu can lead to serious breathing complications. Food preparation for Super Bowl parties this week, also an easy way for this virus to spread, according to family medicine experts at St. Elizabeth Healthcare.
So if a little bit of the virus is on a person's hands, then if they prepare food, they can decimate like everybody that ate that food.
So wash your own hands and keep them off your own face if you want to reduce the odds you'll get sick. You see, it's not just those who prepare food that can give you the flu.
But also, you know, just like, you know, touching things and then you don't wash your hands before you eat.
Oh, there we go again. Now, the vaccine does seem to be a good match if you've had it. If you haven't, it's not too late. You can still get it. Cases can spike through March or April, and experts say they have not seen what appears to be a flu peak yet, which means that we have the cases go up and then we start to see them go down.
That's not good news.
No, and I've seen it spread like March and April. It gets into a daycare, gets into a nursing home. Yeah, so this is important. As always, we want to invite you to give us your questions for providers at St. Elizabeth Healthcare, local12.com, and click on Ask the Expert. These are great questions. You know,
They are.
Too late to get a flu vaccine? No, it's not. All right, we are back at 5:30. Got some great heart health stuff for you guys as we move into our Wear Red campaign for February.
Oh, okay.
Changing your colors up a bit.